Fiscal 2017 demographics show the state of Florida to have 1,525,400 veterans, the third largest in the United States veteran population in the nation, and a full complement of highly skilled and dedicated first responders who risk their lives daily to protect and care for others. Coming up on Polk Place, we'll talk with Chapters Health about a program to honor these individuals. Make sure you stick around. Welcome to Polk Place. I'm Brian Lacey, and joining me in studio is Adam Stanfield. Adam is the Vice President of Development and Executive Director for the Chapters Health Foundation. Welcome back to the show.
Yeah, it's been a long time. Good to see you.
Yeah, where you been hiding?
Over in South Tampa, just around. I get out here every now and then, but, just they keep us busy.
I was telling our boy Austin, man, we got to have you in more often.
I know.
Yeah.
So we've got a couple of things that you've shared with me that are kind of enlightening. So
when
we
were talking about it, I'm getting excited about it.
Yeah.
But for those that don't know, talk to me a little bit about Chapters Health.
So Chapters Health is the largest nonprofit hospice agency in the states measured by census. So we have a very big service footprint. We're continuing to grow every day. We operate essentially mainland Florida. We now have territories up towards the Florida-Georgia border, all the way down to the Florida Keys. And our sweet spot is basically the diagonal across Florida from Citrus County down to Okeechobee. So it's pretty vibrant. Our census is about 2,400 patients on a daily basis, and we're expanding our service line to include home health services and other support services. We have a large bereavement department that services, approximately 23,000 people a year, free of charge. And, it's just a wonderful organization to be affiliated with.
One of the things that we talked about, I'm going to say a couple of years back, one of the programs that you do and have sent in to us is you guys are heavily involved with the military and those that have served. And now with this new program, kind of stepping it up a notch. Let's talk a little bit about the Valor Program.
Okay, sounds good. Well, the Valor Program is a new program offered through Chapters Health. It's funded through the foundation as an unfunded program of Chapters Health, and is really designed to bring better services and awareness to what the needs and the issues facing veterans historically have been. This is a movement that really started in the hospice industry, back in 2010, recognizing that the needs of the veteran hospice patient differ, from an individual, a non-military individual. So they've begun the process of addressing those, identifying those, and understanding those. And over time, the VA has partnered with various hospice groups to create something called the We Honor Veterans Program, which Chapters was a part of. There's 5 levels within the We Honor Veterans Program, and we have achieved level 4 status. But the one thing that we recognize that We Honor Veterans doesn't do per se is it doesn't address the needs of first responders. And when you take a look at it, the first responders experience a lot of the same traumatic events and a lot of the same challenges that many of the veterans do. So from a Chapters perspective, we felt it appropriate to take our success in the We Honor Veterans and package it up into a new program that also serves first responders.
So what exactly are some of the things that folks could see within this program, and how, if we have a loved one, do we reach out and become a part of it?
Sure. Well, certainly, through bereavement services, anybody that has experienced loss over the course of the past year can give us a call and seek help. So that's, again, free of charge. There's no requirement to have an affiliation with any of our Chapters affiliates, Good Shepherd here in the local market. And then also, of course, the hospice services. If somebody's hospice eligible, then they can access Valor related programming, through that. And then also, as we expand our service module to include home health, there's veterans that are out there that are, in need of home health services. So, with that, we are looking to bring again, a better level of understanding as to the needs of the veterans. One of the things that we do are events. Those events can include vet cafes. These are things that we've always historically done. These are activities for veterans to come together and talk peer-to-peer. As you know, there's a lot of comfort in that, and a lot of veterans, talk about, their experiences and things like that. We also do, on our hospice level side of things, we also do honor walks. These are when a veteran passes. We work with the family to give them a recognition type event through a processional where, we drape the veteran in, a military-like Afghan, and we do a procession through the house, leading them out to the exit. We have bells that toll, veterans that are there line the halls, they salute, our staff, covers their heart. So it's very compelling. And other activities that we have going on is as we address first responders, a nightingale call. This is when a nurse will pass on our service. We do the procession, but we carry a nightingale lamp to recognize nurses and things like that.
Talk about the importance of fundraising, which is part of the thing that you do, so you guys can provide services like this for free.
Fundraising is a very important component of this. We've been relatively fragmented only because of chapters being so large, and each of our affiliates have operated individually. But as we consolidate the Valor program into the foundation, we can really get our hands around addressing the programming needs for this, because it's pretty significant. And with our interest of becoming a subject matter expert in terms of providing navigation through the VA, and I'm sure you understand that the VA is great, but it's very challenged, it's very big, and there's a lot of issues with navigating to the benefits. So we want to become subject matter experts in understanding that and better directing our patients wherever they are on our service line to receive the benefits that are due to them. And we can do that, but one of the things we want to do is we want to hire an administrator to oversee this program that can concentrate on developing the relationship with the VA. And with that, of course, comes money and cost. We want to explore honor flights more than what we have in the past. So our budget, we're probably looking at about $250,000 to do all that. And we have a team through the foundation that's dedicated and committed to raising those monies so we can, again, take our veteran service to the next level of development.
Well, Adam, I want to thank you for coming in today and talk a little bit about the Valor program. Don't be a stranger. Come back and talk to me again soon, will you please?
I think we will, yeah, absolutely. Good to see you.
Chapters Health System honors military veterans and first responders with a high quality of life until their last breath. They've been serving and honoring veterans and their families with home care, hospice care, and grief services for many years, and now they've expanded on this unique end-of-life care program to Florida's first responders with the Chapters Health Valor program. Now, if you need more information, you can give them a call at 813-871-8444 or look them up on the web at www.chaptershealth.org.